On page 25, I also want to talk about reciprocal changes. And so when a patient has a myocardial infarct, there may or may not be reciprocal changes, but reciprocal changes increase the accuracy of the ECG or the specificity of the ECG. So the absence of reciprocal changes doesn't rule out an MI, but having reciprocal changes just adds to the evidence. So here, for example, in leads 2, 3, and AVF, we have ST elevation. So we have baseline, J point, baseline, J point. And in AVF, we have baseline and J point here again. And we see ST depression in AVL and in 1. And what this means is that these leads here, 1 and AVL, are looking at the same myocardial infarct, but from a different angle. And consequently, it shows up as ST depression. So they call that reciprocal changes. And as I said, when you're looking at a 12-lead ECG, particularly if the clinical presentation is sketchy, if there's no ST segment depression in other leads, in other words, no reciprocal changes, then you may not be dealing with an MI. You may be, for example, dealing with early repolarization syndrome. So now, again, as I said earlier, the absence of reciprocal changes doesn't rule out MI. So if you have a patient who has strong signs and symptoms consistent with a myocardial infarct, and you just see ST elevation in 2 or more anatomically contiguous leads without reciprocal changes, chances are good of having an MI. But if you've got reciprocal changes, that just increases the specificity or the accuracy.